Imagine being at the mercy of a virus, repeatedly, with no access to the vaccine that could protect you. This is the reality for Ella Halpern-Matthews, a young woman with a severe respiratory condition who has battled COVID-19 3 times in 6 months. The catch-22 of eligibility. Ms. Halpern-Matthews, a historian from Kent, has a history of respiratory issues, including asthma since birth. She underwent a life-altering surgery to remove half of her lung due to cystic adenomatoid malformation, leaving her even more susceptible to respiratory infections. Despite her heightened vulnerability, she recently lost eligibility for the NHS COVID-19 booster vaccine due to updated criteria. But here's where it gets controversial. The criteria for eligibility have been tightened, excluding individuals like Ms. Halpern-Matthews who are not taking immune suppressant medication. This decision has left her feeling isolated and at risk, especially as she takes precautions like wearing high-quality masks and avoiding crowded spaces. The impact on daily life. The frequent infections have taken a toll on her physical and mental health, forcing her to miss out on social events, family gatherings, and public spaces. She feels cut off from society, a sentiment echoed by many with underlying health conditions. Navigating the social scene. Ms. Halpern-Matthews highlights the challenges of socializing in the UK, where COVID-19 discussions are often avoided, testing is infrequent, and people are reluctant to cancel plans when unwell. This has led to difficult conversations with friends and loved ones, and a search for like-minded individuals who prioritize COVID-19 safety. Changing eligibility criteria. The eligibility criteria for seasonal COVID-19 vaccination in England have shifted, now favoring adults over 75, older care home residents, and immunosuppressed individuals. This is a departure from the previous criteria, which included adults aged 65 to 74 and those in clinical risk groups. The two-tier healthcare system. Ms. Halpern-Matthews has been compelled to crowdfund for her next vaccine, as private providers are out of her financial reach. She points out the stark contrast with other countries, where the vaccine is more affordable and accessible. This disparity highlights the existence of a two-tier healthcare system, where those with means can access private healthcare and essential medicines more easily. Chaos in the booking system. The NHS booking system has been criticized for its confusion and chaos, allowing patients aged 65 to 74 to self-declare as immunosuppressed without clear guidance. This has led to aggressive encounters between pharmacists and patients, further complicating the situation. A controversial decision. The decision to exclude non-immunosuppressed patients aged 65 to 74 has raised concerns, especially with the emergence of new COVID-19 strains. The Joint Committee on Vaccination and Immunization, JCVI, suggests that the eligibility list is not exhaustive and should be subject to clinical judgment, considering the risk of COVID-19 exacerbating underlying diseases. This story raises important questions. Is the current eligibility criteria for COVID-19 vaccines fair and comprehensive? How can we ensure that vulnerable individuals like Ms. Halpern-Matthews are protected? And what steps should be taken to improve vaccine accessibility and affordability for all?